Centre for Health Communication is an initiative that was set up at the University of Technology, Sydney. The centre seeks to understand how health professionals communicate with one another and what that communication means for how safe the care is that is delivered to patients.
I've written a discharge letter, and I think she can go home if the bloods are normal, if she's stable, and she
Centre for Health Communication is moving towards working more and more closely with frontline clinicians on making visible their knowledge about practice. We do this because we believe that frontline clinicians are an untapped resource. They are people who have a lot more answers to the problems that we are currently recognizing in terms of a lack of patient safety and perhaps inadequate quality of care. We work with people in health and education, social science, but also in documentary making and in the arts. And this is important because we need to communicate with health professionals in different ways.
As a clinician, we get approached by lots of different academic groups wanting to do research into clinical practice. And I must say that we've been impressed by the UTS Centre for Health Communications. They've managed to fit in at the coalface of healthcare in our ICU and bond with the doctors and nurses to actually achieve something that I'm sure they're proud of, we certainly are.
Video research is powerful because when people see themselves on the screen, they realize that they're watching themselves as another would watch them. And that creates both a distance and approximation. The distance is important because it separates people from the normality of everyday work. The approximation is important because it enables them to identify with what is happening on the screen more than anyone else can. And it is that identification that enables people to say, these are the solutions that we can apply, because we are the people who will be applying them.